Heart Patrol. Grace Wu is examining how job stress drives unhealthy eating and raises heart disease risks among North Carolina police officers, by Mendenhall. In the summer of 2020, Grace Wu was on a quiet car ride to visit her in-laws in Burlington, North Carolina, when a passing thought sparked a profound realization. At the time, her husband was temporarily training as a police cadet, and the stress of the job, paired with irregular meal times, caused him to binge on sweets and comfort foods during his days off. It was the most stressful time of our lives, Wu recalls. As a wife, she was worried about his long-term health. Diets like this can lead to obesity, diabetes, and heart disease. But as an eating disorder researcher and biobehavioral scientist at UNC Chapel Hill, Wu saw something more than individual risk at work. Could high-stress occupations, like law enforcement, be linked to overeating behaviors? And if so, do those behaviors contribute to the high rates of cardiovascular disease often seen in these professions? As she gazed out the car window and saw a patrol car speeding by, she began to connect the dots. Diets and daily stress weren't the only factors. At the time, anti-police sentiment was surging in the wake of the George Floyd protests. Officers were under pressure from every direction. Wu wondered, was anyone studying this? This question sparked a new sense of purpose, and the Carolina Blue Project was born. Launched in 2023, the project aims to understand the unique health challenges faced by police officers across North Carolina. Through surveys and physical assessments, including blood pressure checks and body measurements, Wu and her team have partnered with local law enforcement agencies to build a comprehensive health profile of officers statewide. Law enforcement officers experience life or death situations daily, Wu says, but we don't talk about how that stress affects when they eat, what foods they choose, and how that impacts their cardiovascular health. From nurse to researcher, Wu's research career didn't appear with that same flash of insight. It's rooted in a life that began far from North Carolina. Originally from Taiwan, Wu attended professional school and became an emergency room nurse at one of the country's top hospitals when she was just 20 years old. After earning her bachelor's degree, she spent 11 years as a full-time nurse, teaching evidence-based practices to her colleagues. She also saw firsthand how Taiwan was grappling with the highest obesity rate among Asian nations, with over 45% of the population classified as being overweight or obese, a health risk that motivated her interest in the field of obesity research. Her passion for research deepened during her master's program, when she interned at a weight loss center to study nutrition and exercise with the goal of maintaining weight loss. Patients often confided in her, sharing painful stories of verbal abuse from loved ones because of their size. They've been told, all you need is a little willpower. You'd be so beautiful if you just lost 10 pounds. Or, you are fat because you are lazy, Wu explains. I don't know about you, but if I heard those negative comments directed towards me, I'd find that stressful. In 2013, she came to the U.S. to begin her PhD in nursing at Carolina, focusing on how weight stigma influences behaviors like binge eating. Cortisol, a key stress hormone, regulates metabolism, blood sugar, and inflammation, and is released during periods of physical or emotional stress. But chronic high levels can lead to weight gain, high blood pressure, and mood swings. To investigate her question, Wu collected hair samples from overweight patients who faced weight stigma. Hair cortisol served as a biomarker for long-term stress. She found that frequent experiences of weight stigma correlated with high cortisol levels, which were also associated with increased binge eating symptoms, growing her interest in biobehavioral research. Now a UNC School of Nursing professor, Wu studies disinhibited eating, overeating to cope with stress or negative emotions, which can lead to obesity, diabetes, and high blood pressure. She also researches triggers, consequences, and prevention of disinhibited eating, emphasizing that timing and context are as important as nutrition and food choices. I want to know why we eat, especially if it's to respond to stress and emotion rather than hunger cues, Wu says. Partnering with law enforcement. While many studies have examined stress among law enforcement officers, Wu saw a gap: the interplay between stress, unhealthy eating habits, and heart health. To fill it, she began recruiting officers for the Carolina Blue Project. Participants first completed an online survey designed to capture stressors unique to law enforcement: concerns about dying on the job, attitudes towards anti-police sentiment, and perceptions of community distrust. The survey also asked about eating behaviors like overeating and binge eating. Next, officers underwent health screenings at the UNC Biobehavioral Laboratory. The research team assessed their glucose and cholesterol levels, recorded their height, weight, waist and hip circumferences, and blood pressure. Each officer received a detailed explanation of their results and personalized lifestyle recommendations.